Thank you. I'd like to first thank for the invitation and the opportunity to testify before you today regarding the impacts of COVID-19 on women, or as I like to reframe it, the intersectional gendered impacts of COVID-19. So to start, I'm sure we all agree that we live in a country that isn't equal and where gender inequality persists. And you can see this to be true by looking at the many barriers that women and other marginalized or underrepresented populations in the workplace experience, which I see every day in my work. And you can also see gender inequality in the lack of women in leadership, domestic violence rates in this country, by examining the ingrained biases and stereotypes that we all have and that we've all learned, and by looking at gendered sectors and their value or worth that society places on them. For instance, sectors heavily dominated by men are given greater value than those of women. Also, sectors dominated by women tend to still have male leadership. And also by looking at the persistent gender wage gap. You can pretty much examine any sector in Canada and find evidence of gender inequality. And this was our reality pre-COVID-19. We were also starting an economic slump pre-COVID-19, especially in Alberta, where I'm based. And as you typically see in economic downturns, violence against women increases, caregiving responsibilities to women increase, and many of those other gender inequality indicators skyrocket. Now, once COVID-19 hit, it accelerated and exacerbated all of these inequalities. Then the employment drop related to social distancing measures created a large impact on sectors with high female employment shares. The virus itself doesn't discriminate based on gender or sex, but it's the systems and sectors that we have created and designed that are discriminatory. And COVID-19 is the flashlight illuminating all of the cracks of inequalities in our system. The workers that are most affected by COVID-19 and those that we rely on to keep us safe and informed and are by the very nature of their jobs at most risk of contracting COVID-19 are predominantly women. Our healthcare sector is dominated by women in Canada. Nurses are 92% women. Lab techs are 80% women. Respiratory therapists, which are very important during COVID-19, are 75% women. And home care workers and personal support workers, 90% women. So these workers at the front lines of fighting COVID-19 are all predominantly women. Now, this extends beyond the healthcare sector to other jobs on the front lines of COVID-19. Our grocery store workers are 84% women, food service industry, 72% women, and janitorial staff, 71% women. When we look at the nonprofit sector, that includes food banks, shelters, women's shelters, homelessness supports, supports for people living with disabilities, that sector is 75% women. That sector alone employs over 2 million Canadians, but also relies heavily on a volunteer workforce of over 13 million people, with the majority of those being unpaid, incredibly important unpaid labor that helps support our most vulnerable during COVID-19, and again, predominantly women. And this sector in particular has also been crippled by a lack of financial relief and having to delay or cancel fundraising activities. And then when we look at the health and nonprofit sectors that are predominantly women, also require PPE to do their work and to stay safe. And we've seen a drastic shortage in PPE that's designed to fit women's bodies. We know that the majority of PPE, even those deemed unisex, were designed with only the average male bodies in mind. So we're actually unable to adequately protect these women working on the front lines. Then the education system, which again is dominated by a female workforce. Teachers are 77% women. TAs and EAs are 96% women, have all been drastically affected by COVID-19. And then when we look at the closing of schools, resulting in predominantly women having to homeschool their children, having to become their own daycares, or caring for elderly parents, neighbors, or coworkers, while meticulously cleaning and sanitizing their homes now, in addition to the usual grocery shopping, organizing laundry, and then all of this is on top of working their usual day jobs. And we know this because 75% of women caregivers in Canada are also employed full-time. We know that women are more likely to work over 20 plus hours a week than men as a caregiver, and twice as likely to provide personal care. And these stats come pre-COVID-19. When we apply an intersectional lens, we also learn that racialized women have more caregiving responsibilities than white women. Or alternatively, COVID-19 has also resulted in women having to completely drop out of the workforce due to these heavy caregiving and schooling responsibilities. A study was recently conducted to verify this and found that the majority of women that were seriously considering quitting their jobs during this time due to this caregiving were single mothers, then racialized women, followed by Asian women, and then white women. We also know that in March alone, labor data revealed that women accounted for 2/3 of job losses, despite making up less than half of the workforce to begin with. And those that didn't lose their job lost 50% more work hours than men. Also in March, women between the age of 25 and 54 years, so that core sort of working group, lost more than twice the jobs than men in that same age group. And nearly half of this decrease was among women working in part-time, often low-paying jobs in the service or care industries. In other cases, it's been reported that women are choosing to exit the workforce. So between February and March, the number of core-aged women who were not in the Canadian labor market grew substantially by over 10%. But this isn't a choice to leave the workforce. It is a need because, for example, in heterosexual relationships, women are typically paid less than their male partners, expected to be more responsible for caregiving, and now someone has to do it and look after children and school them because they're all at home together. And the CERB program may help these women in the short term, but this unfortunately will also have longer term negative effects on their career and future earning power that needs to be considered. The pandemic has also resulted in heightened domestic violence. Shelters, support organizations like the YWCA, and organizations that provide informal support to survivors like CEGES in Calgary, as well as policing agencies, have all reported heightened domestic violence rates. And several of them mentioned that the rates were lower at the beginning of the pandemic due to strict social isolation, where women were trapped at home with their abusers, as an example. And then once restrictions started to loosen, the rates just skyrocketed. We also know that women are more likely to experience poverty and have lower incomes. And women work 2/3 of minimum wage jobs, putting them at increased risk of unemployment and living a greater risk at poverty. So all of these impacts that have been documented thus far contribute to greater gender inequality in Canada. So in order to mitigate these disproportionate impacts and to prepare for a second wave of COVID-19, we need to ensure that all of our decisions are made with an intersectional gender lens to ensure that we're not repeating these patterns of inequality and discrimination, and that we can begin to make incremental, lasting change for the betterment of everyone. I'm an advocate for Gender-Based Analysis Plus, or GBA Plus, and it's incredibly important to ensure that this lens is being applied to all COVID-19 response, management, and prevention decision making. So now is the time to double down on GBA Plus. A good GBA Plus analysis doesn't just examine sex and gender, but also includes race, ethnicity, culture, language, ability, age, sexual orientation, and other factors like geographic location. So GBA Plus informed government programs would then be more effective and tailored to specific regions in Canada to remove barriers that specific populations may experience. And the Canadian Human Rights Commission, the G7 Gender Equality Advisory Council, and the United Nations, along with a multitude of gender equality stakeholders across Canada and the world, have been advocating for countries to take a feminist approach to COVID-19. If we don't double down and ensure that an intersectional feminist lens, like GBA Plus, is effectively applied to all of our decisions and interventions, then we will fail Canadians, and women will continue to bear the brunt of the pandemic. Thank you.
Thank you very